Go ahead.
Good afternoon, everyone. This is Carmen Wapagijik-Nuchtai, Director of Health and Community Wellness for Tikmikshing. Welcome to our Health Q&A for this week. Today is October 8th and we are at 3:16 p.m. The only reason I say that is because this is a recording and you may not see it at the moment. And so I will be going through the COVID cases updates, but also we have a panel here. So our panel today consists of Marina McCumber, our community health nurse, Rachel Pattison, our health programs manager, and Amanda Wapagijik-Jourdain, our health promotions manager. And in the background, we have Bridget Prowse, who is our communications officer. So we will begin today's health Q&A. Last week, we didn't put one on, so we were looking at having a bi-weekly update to the community. And this will be assessed. If there's more information that needs to go out, then we can revert back to weekly. So with the COVID cases update, at Tikmikshing, we have 0 confirmed cases, and we have 1 resolved case. Public Health Sudbury and Districts has reported a case on October 6, 2020. This represents 109 cases, and of those cases, 106 of them have been resolved, so meaning there are 3 active cases in Sudbury. The Ontario government is reporting 797 confirmed cases. Total confirmed cases for Ontario is 56,742. Resolved cases is 48,308, and deaths are 2,992. We also see that the different areas within the province are experiencing higher volumes of COVID cases. In particular, our Toronto, Peel, Ottawa, York region. Please ensure that you self-monitor if you have to go to any of these locations. Next, we'll move on to Rachel, and she will do the state of emergency.
Yes. Hi, everybody. So the state of emergency here in Tikmikshing was amended and approved on September 21st, along with the reopening plan. And it is posted on the COVID-19 update section of our website. You can find it. I don't know if she's going to post it here. The tikmikshing.ca/COVID-19-updates/. I think, Bridget, I'm not sure if you posted here somewhere. The previous state of emergency had expired on September 29th and it was extended to October 31st. This extended measure just allows the flexibility to creating and implementing measures for the safety of our community. So Marina will talk more about that amended order.
Good afternoon, Tikmikshing. Gimmon Council met on Monday, October 5th, and amended order number 20-01-04. Changes to the order consist of 1, to remove the testing requirement for staff and community members traveling to areas that have higher incidences of COVID, and that's to the gathering section of the order. So 1A, removing testing requirement after traveling to a location with higher incidences of COVID. The government has changed its guidance on testing. Only for those with symptoms will qualify for testing now. So B, limiting the number of persons permitted to social or private gatherings. This includes private residences, backyards, parks, and other recreational areas. And C, the limits do not apply to events or gatherings in staff, businesses, and facilities because they must already follow specific public health and safety guidelines to minimize risk and limit spread of the virus. This includes restaurants, gyms, recreational, sporting, religious services, rites, or ceremonies. The community center permits 50 people for religious services, rites or ceremonies, and funerals are included in this. D, those traveling outside of Canada must isolate for 14 days on their return, and no testing is required unless they're symptomatic. And E, when members are required to travel, they must take reasonable preventative measures to mitigate the risk of contracting the COVID virus and must wear a mask when traveling. There are exceptions to this rule, such as age and medical conditions.
Okay, so next is Amanda on the reopening the community plan.
Hi. Can you hear me?
Okay, Amanda, are you going to do your section?
I think I froze there for a minute.
Okay, sorry.
Okay, so reopening the community plan. The plan was amended and approved by Gimana Council on October 5th, 2020, and includes the following changes. Screening tool has been updated. Masks have to be worn in all public buildings. For meetings, ensure that all participants abide by the measures put in place with physical distancing, wearing a mask, and not exceeding the capacity limit for the meeting space or facility. Travel restrictions changed, as Marina said. Individuals who have to travel to areas with higher incidences of COVID-19 are no longer have to get tested, but you must self-monitor for 14 days. And if symptoms arise, get tested and self-isolate until the results are received. Symptoms include new or worsening fever and chills, difficulty breathing, cough, sore throat, trouble swallowing, runny nose, nasal congestion, decrease or loss of smell or taste, nausea, vomiting, or diarrhea, or abdominal pain, not feeling well, extreme tiredness, or sore muscles. Any travel outside of Canada, you are required to self-isolate for 14 days. Social circles are on a pause at the moment. The plan can be found on the website and is shared with staff, visitors, and those who provide a service to the community, ensuring that all are aware of our measures.
Okay, thank you. So we're back to Rachel on gatherings, physical distancing, and social circles.
On Marina's changes to the orders, gatherings and physical distancing and social circles. The public health Sudbury districts is reminding everyone that the safest options are to avoid non-essential travel. Limit indoor gatherings to your own household. Be outdoors. Go virtual. Practice physical distancing and hand washing, and of course, stay away if you have any symptoms. Although it is permissible for up to 10 people to be indoors and 25 outdoors, non-essential in-person gatherings of any size should be limited. Limiting our contacts and in-person interactions as much as possible is critical in reducing the transmission of COVID-19. With a few exceptions, gatherings are currently maxed at 10 people indoors and 25 people outdoors. Unless people are from the same household, they should keep 2 meters, 6 feet apart and wear a face covering if distancing is not possible. Face coverings must be worn at all times in indoor spaces, and they must be also worn in other indoor spaces where distancing is not possible. As of October 3rd, the province of Ontario is pausing social circles and advising that all Ontarians allow close contact only with people living in their own household and maintain 2 meters physical distancing from everyone else. Individuals who live alone may consider having close contact with another household, and we have followed suit with the government.
Okay, miigwech, Rachel. Just to add, so we do incorporate a lot of what the guidance documents are from public health and from the Ontario government. We also have the federal government that provides us with guidance as well. So I just wanted to mention that. So coming in, having entered this second wave of COVID-19, it continues to be critical that we all take the necessary actions to prevent the spread of COVID-19 while supporting each other. We have received many questions from communities about the safety of social interactions and gatherings, and this is from the public health website. And they recognize the importance of gatherings and the communities that are making their decisions, that they would like to provide and offer that guidance. So we have been, utilizing a lot of the public health guidance documents along with the Ontario government. And with this second wave, we just want to ensure that our community is safe. So making sure that, we stay home if we're unwell. We maintain that physical distancing of 6 feet, continuous frequent hand washing. If you can't use any wash your hands, then the hand sanitizer is the next best thing. Wearing non-medical face coverings indoors and when physical distancing is not possible, so definitely wear your mask. Limiting the number of contacts that each of us have every day is really extremely important in limiting the spread of the infection. And that is another reason why the social circle has been paused. So we have seen a lot of numbers increase in the southern area, which is causing all of these different changes that the government is putting into place. And it's to be safe and to keep our members safe. We follow those same suits. If gatherings cannot be postponed, people to keep their distance, clean their hands, and wear masks. So outdoor gatherings is permitted at 25 people and indoor gatherings at 10 people. You cannot merge those two numbers together. So it is recommended that you really maintain and be diligent as to where you're traveling to, where you're going. This weekend, we all know that it is Thanksgiving weekend, and we all want to be, with our families, and it's, it does pose some difficulties and some challenges for a lot of individuals. So it is recommended that we limit our gatherings to 10 people indoors or 25 outdoors. People with higher risk of severe COVID-19 illnesses, particularly those who are over the age of 60, they should be extra cautious when interacting with others and limit your exposure to others. And this also goes for children. We have seen that children may have different symptoms, and this has also been out into the guidance documents as well. So keeping an eye on those as well. Now we're going to go next to Amanda, and she's going to talk about the COVID-19 school and childcare screening.
Okay, so it's just visit the Public Health Sudbury District website, click the link COVID-19 School and Childcare Screening Tool, answer the questions to help you decide if you should go or not go to school or that childcare that day. So you must screen every day, and before you must screen every day before going to the school or childcare center. Using this tool is optional and is not tracked or enforced. But let's do our part in keeping others safe.
Okay, thank you. So I actually did that screening tool last night, and it's a really good screening tool, especially if you use the online one. It brings you down to different things, and if you be careful where you answer, because I answered a no when I should have answered a yes, or vice versa. And it told me, stay home, go get a test. So be careful, because I just automatically thought, I'm going to go yes, yes, and then I didn't read. So be mindful, read. So that brings us to the end of our health Q&A. We hope you enjoyed the information. If there's anything or any questions you have, feel free to contact any one of us on the panel or at the health center. And you can also look at the website. We have all the updated reopening plans there. So that's it. Stay safe. Bon appétit.
Have a
safe.
great weekend.